Welcome, everyone. Assalamu alaikum. I'm AYESHA Rahman, the moderator for this program for how to become an advanced practice provider, nurse practitioner, or PA. We'll start with a dua before we begin. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahman ar-Rahim. Maliki yawmiddin. Iyaka na'budu wa iyaka nasta'in. Ihdina as-sirata al-mustaqim. Sirata alladhina an'amta alayhim ghayra al-maghdubi alayhim walad-dallin. Ameen. O Allah, most merciful, most kind, master of the day of judgment, you alone we worship, you alone we ask for help. Guide us to the straight path, the path of those whom you have favored, not of those who earn your anger, nor of those who have gone astray. Ameen. All right, and so I'm going to go ahead and bring up our slideshow for today. This program is This program is brought to you by AMWPA. This is a nonprofit organization led by Muslim Physician Association, founded in 2008. The vision for this organization is to provide preventative healthcare services to our Muslim community, as well as empower Muslim young females and Muslim individuals in embarking into the healthcare field. We have provided many services during the COVID pandemic and providing masks to our community, providing snacks and fuel for our healthcare workers on the front lines during the COVID pandemic, and providing educational lectures to our community regarding healthcare matters. This program, I am the moderator. My name is AYESHA Rahman. I'm a family nurse practitioner. I'm currently board certified through the American Academy of Nurse Practitioners. This is a picture of me back about 10 years ago when I was in nursing school. My journey has been about 10 years, almost in nursing. The 2023 will be 10 years. I started as a bachelor's of science of nursing. I worked in Parkland as a registered nurse for some time, and then embarked into my master's as a nurse practitioner. I've been in internal medicine private practice as a nurse practitioner, and I currently practice in GI part-time and urgent care full-time. And this is just a quick glimpse of some of our activities through AMWPA. I'm part of the Allied Health Committee of AMWPA. This is a group of healthcare professionals that are non-physicians. We are nurse practitioners, PAs, pharmacists, occupational therapists, physical therapists, dental hygienists. And so we are together, we try to provide some healthcare services to our community. One of the ones that we've done as well is the CPR programs to our community out in the masjids. So these are some pictures of some of our activities of performing CPR mannequins and teaching the community how to perform CPR in a life-saving event that's needed. I'm going to start with introducing our panelists next. So our first panelist is NAWAL SULEMAN. NAWAL, if you'd like to go ahead and start your introduction there.
Hi, my name is NAWAL. I'm a PA. So a little bit of background of where I started and where I am. So currently I'm a PA at a family medicine clinic in Capel. I went to undergraduate at UT Southwestern and graduated with my honors degree in kinesiology with a minor in business administration. After that, I kind of took a year off and I taught kindergarten. And then after that, I went to PA school at UT Southwestern and graduated last year in 2021. And during that time, I got married, alhamdulillah. So I'm open for any questions you guys might have at the end of this presentation.
Thank you, Nawal. Next, we have FASEEHA RAZA, who's a physician assistant.
Yes, assalamu alaikum, everybody. My name is FASEEHA. I'm a PA. First of all, I would like to thank AMWPA for organizing this event and information session for everybody who wants to be an NP or PA. I myself, I'm a board certified physician associate. I'm specializing in medical and cosmetic dermatology. I also practice primary care medicine as well. Currently, I'm working at Sheik Derm Aesthetics. It's a dermatology practice based in Allen, Texas. I also work as a primary care physician assistant at Heal 360. A little bit of background about my education. I received my master's in medical sciences and PA studies from Baldwin Wallace University. And then I did my undergrad in health sciences from Cleveland State University. I hold an associate in architectural engineering. Leadership-wise, I am the CEO at Sheik Derm Aesthetics. I'm also a member of Board of Trustees at Dermatology PA Foundation. Currently, I'm serving as the Vice Chair and Incoming Chair for Distance Education Committee at SDPA. I have previously served as Director of Community Health Education at Cleveland Ibicina Free Clinic, and I also have served as Director of Communications at Cleveland Ibicina Free Clinic. I'm truly passionate about nonprofit organizations and the work they do, and it is always an honor to work with those organizations such as AMWPA. I look forward to contribute in the field of education, research, and philanthropy. So thank you so much for having me, Aisha.
Thank you. All right, next we have Dahlia.
Hi, Assalamualaikum. My name is Dahlia. I am a nurse practitioner. Let me see. I have been a nurse for about, I've been a nurse practitioner for about 7 years, and I graduated from Texas Women University. Currently, I'm working for hospitals with Envision Healthcare, and what else? But I normally run at the nursing home, usually the skilled patient. I think that's pretty much it.
Thank you, Lilia. Appreciate it.
Mhm.
All right, so next for our program, this is just I want to pause and kind of discuss. I think it's a very important for all our young individuals wanting to enter into the field that you should ask yourself, why do you truly want to become a nurse practitioner or a PA? It is a long journey entering into the field when you're going to school, but also whenever you're practicing in this field. Just like a physician, it is a very can be a very straining lifestyle of balancing the practice as well as family life, and so you have to have a strong passion for it in order to enjoy what you're doing and as well survive the field when you're working. I know, as for me personally, I'm a first-generation American. My parents moved from India in their 20s and 30s, and like most parents, they told me I should become a doctor or an engineer. These are kind of the two choices we're given as first-generation Americans from our parents. One, because they haven't been exposed to these other healthcare fields that are out there. There's other options besides just being a physician or entering into engineering. And these occupations are very rewarding and also very credited actually in the field. So main thing is to understand, is it something truly that you want rather than just fulfilling a passion for your parents or making sure that you're meeting their expectations? It should be something that you also want to do. For me personally, I have a very strong passion for pathophysiology. I constantly want to learn. And in this field, you always learn. There's so many different medical diagnoses and conditions that are out there. You're constantly learning. It's not just when you graduate. You have to constantly make sure that you're keeping up to date with guidelines and educating yourselves to learn more. And that way you can build your expertise and your own your knowledge base so that you can benefit your patients as well. The other reason was because I see this as a very good reward for the community as well. If I can be there as an advocate for my patients and touch someone else's life, then it makes a big difference on that person. And you can form empathetic relationships with patients quite a bit. Empathy is a big strong suit that I have for others. When I meet my patients, when I talk to them, I try to really listen to understand what's going on, and I feel that it does make a big difference in the patient's plan of care. And with our religion as well, right? The big thing is that we want to do good for others as well, and to make our community stronger. And so not just with the Muslim community, but with our patient community, I feel like it's a strong base that, performing empathy and doing good to others will go a long way and also help even spread dawah to the community as Muslim individuals in healthcare. So that was a big thing for me personally, and understanding that this is what I want to do. And also actually advocating for myself to my parents to say that I don't want to, be in the physician role. It's not for me. The reasons were I want to have both a family life and a career life. I feel like definitely our career clock and our biological clocks are competing with each other as Muslim females especially. And I found that this was a very strong balance for me where I could have my family, but I could still practice and be a working mom and a working female as a Muslim. And so this was a very good, strong suit for me. And I'm very happy with the role that I've chosen. And my parents are as well. They are very proud to see that I can practice the same scope of practice as much as a physician. We split the patients up. We see the same scope of practice. If there are any questions, we work as a team. It's not that we're under anybody. We're working as a team and as a collaborative interdisciplinary members. So we're working together rather than under another individual. And so it is a very strong career to choose and be in. It is very rigorous as well, because we learn quite a bit the same things as physicians do in school, but a very shorter time frame, and we have to pick it up very quickly. And physicians are very thankful to have NPs and Ps at their side. There, as you know, that the community, the patient base is growing. We have more patients than healthcare providers in the community, and doctors can't do it alone. They need help. And so they are very thankful to have an NP or PA at their side to train them with their expertise and pass along that wisdom so that we can learn from them. And it's a very big honor. I feel very honored to learn from my physicians. They are so wise and they have so much expertise, and they pass that on with such grace and wisdom to us. And to have that knowledge and actually have those mentors in our lives and then use that knowledge to benefit others, it goes a long way. So I do feel like we're a strong team together when I work with my physicians, especially in the AMWPA organization and performing preventative health care, and as well in my career base in gastroenterology and internal medicine and urgent care. I've had phenomenal mentors that have been with me along the way, and we work as a great team with each other. So that's a big thing. I think everyone should ask themselves, have a strong passion for it, so that you can go a long way with your career and actually have that own personal satisfaction in your job as well. All right, so I'm going to go ahead and begin with the nurse practitioner portion, and then we will have a second portion for PA. So steps leading into NP school. First, actually, it starts with your bachelor's degree, and not just any bachelor's. You have to have a bachelor's in nursing. You have to actually become a nurse, a registered nurse, and practice for some time before you can enter into the nurse practitioner role. So as you can see in this first portion of the road here is the Bachelor's of Science in Nursing. It is a 4-year degree program and a very rigorous program as a bachelor's degree that we enter in. You have to apply actually to get into your Bachelor's of Science in Nursing, and it can be very, very tough. Actually, we see only 10% of the class actually enter into the program for bachelor's degree programs. For me personally, back in 2000, I think it was 10 or 12, I was applying, and we had 1,200 applicants and only 120 got in. So top 10% gets into the program. A lot will have 4.0 GPAs, but they also want to see that you're going beyond that. You're active in your community. You can actually handle other responsibilities rather than just being in your studies. So they look at that as a whole. And there is even an entrance exam, such as the HESI exam, that's out there that you have to actually take and then fulfill prerequisites before you can enter into a bachelor's degree of nursing. Once you complete your bachelor's of degree in nursing, the next is the NCLEX board exam. So actually this is a license to practice as a registered nurse. And so the board exam is called NCLEX, which is also a very rigorous exam that we do study for. And we have to apply, after this to get a state licensure with the Board of Nursing. Once you have achieved that, then you will go out in the field and work as a registered nurse. And many nurse practitioner programs do require that you work full-time as a registered nurse before you apply to NP school. And this is pretty reasonable because you need to have background experience in healthcare to have that expertise and integrate that to expand your scope of practice, because you have an RN scope of practice, but when you're becoming a nurse practitioner, you're taking it at another level and bringing that at a larger base. And so having that background experience in healthcare, performing patient care, handling time management, and all the tasks that RNs have will make a big difference in your NP career and your expertise whenever you graduate from NP school. So that's a big thing, is about 2+ years of full-time experience. And then lastly is the GRE exam. So once you're ready to apply to NP school, you've already gotten your full-time experience as a registered nurse, you do have to take a GRE exam. Some programs don't have a minimum requirement, but others may, where they want to score about 300 or above cumulatively on the GRE. So it just depends on what programs you're applying to, but in nature, they'll just want at least the GRE as an entrance platform exam before you enter the program. So that's the first slide here on NP school entrance requirements. Before I go further in that a little bit, I do also want to kind of highlight Bachelor of Science in Nursing, what you would gain whenever you get this preliminary degree before going to NP school. So the requirements whenever you're going to get your Bachelor's of Science in Nursing before you get into the program, like many, bachelor's degrees, you have basic, your basic classes like English composition, political science, history, but then the science base is going to be biology 1 and 2. You're going to have nursing chemistry, microbiology, anatomy, physiology 1 and 2. You do need algebra and a statistics course. Pathophysiology and pharmacology will also be there. Some of these programs might have it integrated after you enter a nursing school, but some may say that we want you to go ahead and have these classes done before you apply to know if you can handle these advanced courses and excel in those courses before entering a Bachelor's of Science program of nursing. Some may require psychology programs, psychology classes or nutrition classes. So it's very important that you look at which schools you're applying to for Bachelor's of Science in Nursing and have these prerequisites before getting in so that you have, a wide base of applications that you can apply to. And then once you enter the program for Bachelor's of Science in Nursing, you're going to have in-class and in-class programs and as well as hospital clinicals. So this was really strong point for me when I got my bachelor's degree, that I would get hospital experience through the university without having to look for volunteer experience. The hospitals would place us into these hospitals and get real life experience with patients at an early stage. And you would also get advanced courses in pathophysiology, pharmacology, integrating these very advanced courses beyond just the basic sciences at such a young age. That's there basically in your junior year of college, actually, of your bachelor's degree, you start getting these experiences. So that was a strong suit for me when I chose this degree as my bachelor's. And you also get to experience specific specialties such as pediatrics, women's health nursing, ICU nursing, mental health. And I think these exposures are very helpful early on because you get to understand what is going to be your strong suit. Like, what are you going to like? Are you going to like being in the emergency room? Do you want to go into women's health? Do you like the ICU setting? And being able to experience that in a bachelor's degree program was a very strong suit for me because you get that exposure early on. You get to find out what your passions are early on, but also to figure out what are the specialties that you probably don't like and you want to stay away from. Being in the background and shadowing, but also even performing patient care at that young stage was very helpful for me. And then once you finish your bachelor's degree program, then there's the postgraduate requirements, which I kind of highlighted was the NCLEX exam, and then applying for a state license as a registered nurse at the Board of Nursing. This just picture below is just kind of an old picture about 10 years ago when I was in nursing school during my clinicals. I was in our class of 2013. So that's a picture of me back in nursing school when I was going through my bachelor's degree. And so that's kind of just Bachelor's of Science at a glance. So kind of get a further look at what you would get early on in your bachelor's degree as your first degree that you would have to go through before getting into NP school. And then the last thing is kind of the RN experience. So you do have to live that RN life a little bit before you get into NP school. It is a good 2+ years full-time experience. But when you branch out, you can go a long way. You can get into bedside nursing, going through med-surg, ICU, oncology. You can do home health nursing. You can go into the OR. You can get into the cardiac cath lab, dialysis, pediatrics, labor and delivery. The options are endless and you can interchange as much as you want into these specialties. A lot of programs will do a graduate nurse program. I personally did a registered nurse residency at Parkland where I was in a program that had didactic classes as well as real life experience with a nurse full-time when I was working as an RN at Parkland in step-down ICU and cardiac unit. And that was very helpful to have that side-by-side experience when I'm having a brand new life licensed as a registered nurse, and having that training that's there. So these are some benefits that you get: early work experience, you get a full-time job right out of your bachelor's degree, and also get to get very hands-on experience in the programs whenever you're doing your bachelor's in nursing there. And then NP school. So once you get in, once you're trying to get into NP school, there are, these prerequisites. So like I mentioned earlier, you'll get your bachelor's of science in nursing. You'll have your work experience. You're going to do a GRE entrance exam. What's very important to understand too is that you do have to have a certain GPA from your bachelor's in science and nursing whenever you're applying to NP school. Most will say about 3.0 or above, but to be competitive, you do want to keep about a 3.5 GPA or above. Like I mentioned, it is a very rigorous program, and it can be very hard to maintain those GPAs sometimes. So it's very important to have a very strong work ethic and to study and make sure you balance the curriculum that's being given in the bachelor's program. Personally, for me, it was very tough in the beginning, but thankfully I was able to graduate magna cum laude with my bachelor's. It was very hard, but I was able to do that whenever I was in my bachelor's degree program. And it really taught me a lot early on that it's more than just memorizing facts with medical facts and these things. You have to integrate taking the knowledge that they're giving you and applying it into critical thinking. And it's very hard at that young stage in your bachelor's to understand that. And that's why there's a struggle at the beginning. But I think that teaches us a lot of work ethic and applicability into real life experience, that it actually helped me to do well in my nurse practitioner degree as well. And then something about the applications for an NP school. So most programs for advanced health sciences, they only open applications once a year, but with NP school, it's a little nice. They open it twice a year. So if you don't get in the first round, you can apply in the next cycle that's actually coming up twice a year rather than waiting a full year to get in again. These cycles open about February and September, so fall and a spring cycle that's there. And so that's the nice thing, that you do have more opportunities to apply where you don't have to wait as long before trying to get into the programs. When you are in NP school, there is, again, just like your bachelor's, you're going to have in-class didactic courses as well as clinical courses. The beginning of the program, the first year or two, they're going to have more didactic courses. So you're going to do advanced pathophysiology. So want something very similar to bachelor's, but in a very advanced version of that. Advanced pharmacology, advanced health assessment, how to understand to perform, head-to-toe assessments as a advanced healthcare provider. And then they also integrate nursing theory, health policy, evidence-based practice. So research is a really big, strong point in advanced health nursing programs, that they also want to integrate this, that we can be able to understand how to take a certain aspect in healthcare, and that we have a question about it, we can go in further and try to understand what's going on, what are the questions, and can we further answer these with better practices. So evidence-based practice is a huge concept in nursing, that we take certain ways we're practicing healthcare at this time and improve it and do better for our patients. And so that's something that they introduce early in NP school that goes beyond just pathophysiology and pharmacology, that we'll introduce some research as well in there. And then there's other courses such as FNP, which is Family Nurse Practitioner Concepts, or if you're in acute care NP program or pediatric NP programs, they're going to have those specific specialty-based concepts that they're going to introduce. And chronic disease management, there'll be 3 different versions of that they integrate. Chronic diseases such as diabetes, hypertension, things that you're going to see in primary care specifically, and applying those into a new level where you're going to learn how to diagnose, treat, prescribe, and evaluate these patients and the real life role that you would do as a nurse practitioner, and how physicians do as well. And so these are your clinical preceptorship programs that require 630 clinical hours that you are partnered with a preceptor in a clinic setting, or if you're in acute care in a hospital setting, to get that real life experience and apply what you're learning in class and bring that into the clinical practice there, and integrate that in your new role that you're going to have when you graduate from NP school. And so one thing with this NP school, when you apply, there's actually different tracks that are going going to be there. So depending on what specialty that you desire, you can apply to family nurse practitioner, which is going to range from pediatrics, adult health, labor, women's health, and then also geriatrics, which is our patients over 65 and above. So that's family nurse practitioner. It's primarily outpatient care that's going to be there. However, if you are an ICU nurse or you want to be in the hospital, you can do acute care nurse practitioner program. If you are a pediatric nurse, they want to be a pediatric nurse practitioner, you can do a pediatric NP program. So there's different tracks that are there. All the NPs, maybe the first year or so, will take some of the same basic courses, and then we split apart into our different tracks depending on what you've applied to. So, there's a variety of different specialties even in that when you apply to your tracks. And say I'm an FNP, I'm a family nurse practitioner, but say I wanted to go back and become an acute care NP. Do I have to go through the whole program all over again? No, I don't. It's actually something called a postmaster certification. So I can go back and just take senior level courses, which is usually about 3 semesters of the specific track that was there. So if I want to do acute care NP, I'll apply to the program as a postmaster's. And so I'll go get those classes and then get that experience, and then take another board exam to certify into that specialty. So you can go different ways without having to start all over again either. And so that's the nice thing I liked about NP as well, and nursing curriculum that was out there. And then lastly is postgraduate from NP school. So in this, you're going to apply for a board certification. However, rather than the Board of Nursing applying through there again, you actually have to go a little step further. We have nationally accredited nurse practitioner agencies called American Academy of Nurse Practitioners and the ANCC, which is American Nurses Credentialing Center. So these are nationally accredited board certifying agencies that you will apply to as a nurse practitioner to be accredited. And there is a board exam for that as well. You will take that right after graduation. And then you have to renew this board certification every 5 years. But whenever you renew, you don't have to take the board exam every time. There is an option for CME and practice. If you've been practicing 1,000+ hours in your field, you can use that along with 125 hours of CME credits to renew your board certification every 5 years. But if you've been out of practice, then at that point you do have to do board certification, take the exams again. So that's one thing after graduating with your NP license. And then you do have to apply to the board of nursing just to tell them, I have my RN license, but I'm expanding my scope of practice. So I would like to apply for an extension of an APRN license, which is an advanced practice registered nurse license with prescriptive authority. So this gives us the ability to expand our scope of practice as a nurse and prescribe medications to patients. This will be renewed every 2 years at the Board of Nursing. They do have licensure fees with this as well. However, when you work as an NP, many of your practice agencies will give you an allowance every year for CME credits, for licensure fees. So a lot of times we're not responsible for paying for these fees each time. A lot of the practices I've worked for, they give us an allowance of $1,000, $1,500, $2,000 a year to do CME credits for licensure fees, and they just reimburse you. So that's kind of the nice thing there. And then DEA license, like many physicians, we also can apply for something called a DEA license. This is actually a controlled substances license to prescribe narcotics or controlled substances that our patients may require. It's not a requirement for you to have this, but many practices do have somewhere or the other a patient that's going to need some of these type of medications. So it's good to have this on board. This is also, I believe, about $750 every 3 years that we pay for these licenses, but our agencies or practices will reimburse us for these fees. But you do renew this about every 3 years as a nurse practitioner. And these are very similar things that many advanced health care careers do. Like physicians have board certifications, they have renewals, they have DEA licenses. So it's kind of nice that we have something very similar to what other healthcare, interdisciplinary fields have out there. It's very similar in that nature. And we are board certified, so we have accreditation to be practicing and, have that ability to see patients and integrate our knowledge in an advanced healthcare field, which is thus the name advanced care practitioners or advanced care providers that we're called. They used to label NPs and PAs as mid-level providers, but we've gone away from that because we do acknowledge that we are advanced healthcare interdisciplinary teams. And so main thing is with that, they did change the name through ANP and ANCC. So next I'm gonna, this is just a highlight of NP school programs, TWU, UT Arlington, Baylor Dallas, TCU, Texas Tech Lubbock, and UT Health Houston are some programs that offer nurse practitioner programs. So you can look at these websites and apply to these if you're a current RN or you're looking to become an NP. These are the local programs around the Texas area. Next, I'm going to hand it off to NAWAL. We're going to start the PA school entrance requirements here.
Yeah, so we'll switch gears and talk about how to become a PA now. So PAs and NPs have a very similar scope of practice. We do a lot of the same things. So I'll try to highlight some of the differences to kind of help give you guys an idea of deciding which route you want to go. So we'll start with one of the biggest difference is how you become a PA compared to how you become an NP. For NP, you have to go into nursing school. For PA school, you can get a degree in anything, any undergraduate degree. The important thing is you need to get the prerequisites so you can apply to PA school. And so a lot of the prerequisites are your big sciences, 2 chemistries, 2 biologies, 2 anatomy and physiology, microbiology and OChem, and a few others. So that's why a lot of people tend to go do a science degree because they can knock out a lot of the prerequisites, but you also have an option of doing a business degree and then getting your prerequisites and kind of focusing your energy on those, because it's really important to maintain a really good GPA. It's very competitive to get into PA school. And one of the first things they look at is your GPA, preferably a 3.6 or 3.78 and up. So it's really important that you do put in a lot of effort to make a good grades. We do have a few people in my PA school that did do other stuff besides science degrees, so that's an option. Another thing to make you competitive to get into PA school, so kind of let me give you an idea of how competitive it is. You have thousands of people applying and a few hundred will get an interview, and then our class was a class of 60. Before it used to be classes of 30 a few years ago, they've expanded to classes of 60. Every PA school is a bit different, but usually not more than, they're all less than 100 students. So it's really competitive. So having good GPA helps you. And then another thing is being involved in campus and outside of campus. So volunteering as much as you can, joining student government, joining PPA organizations, joining really any organization that you're interested in is good. Getting leadership positions, whether you're going to be the president, the vice president, the secretary, you're on a committee, anything like that is really important. And then finding a way to get patient care experience. Some schools have a requirement of you need this many hours to get into our programs. At UT Southwestern, we did not have a requirement, but they wanted to see that we were, that we did have some patient care experience. Kind of the reason for that is they want to make sure that you know what a PA is. They want to know that you've interacted with one and you know the scope and that you know what you're applying for, so that you're not taking a seat of someone who actually knows what a PA is and wants to be a PA. So there's a list of different things that you can do to get patient care experience. You can volunteer if you want. It's kind of difficult now with COVID, and even before COVID, just finding a place that will take you in, let you spend hours and hours. It was really hard. So finding a way to integrate it by getting a job in one of these is great, because you're getting money on the side and you're also getting all these hours. So whether you want to be an MA, an EMT, you want to do an ER tech or any kind of tech, surgical tech, CNA, all that is really good. Phlebotomy is another good one. So those are things you can consider. And then after you finish your bachelor's degree, you need to take a GRE exam to get into PA school. It's kind of similar. There's not a specific score that you need to score, but preferably the higher you score, the better. There are some rumors now, or it's not a rumor, actually, it's true that they've started having a PA CAT similar to the MCAT. So a lot of right now, I looked at the list, it started back in 2020. So it was before my time. So I'm not sure what all entails, but it is more science-based tests. And right now it's not a requirement for most of the schools that you apply to. When I looked at the list, there's only about 6 or 7 that are requiring it. Other schools are letting you pick between the GRE and the PA CAT. So that's something that you should look into before you start applying, just to get an idea. From the list that I saw, there was only one Texas school that required it, and that was Hardin Simmons and Abilene. The rest are not there yet. So that's something, if you're applying in the future, keep an eye out. Are you needing to do the PA CAT or can you do the GRE? Do you need to do both? Probably not. It'll be one or the other. Okay. And then after that, need to start applying to PA school. So another difference between PA school and NP is the NP, they have 2 cycles, 2 years, it opens 2 times a year. The PA cycle only opens once, and it's in April. The good thing about how they're doing it now is in the past, it used to be every school you want to apply, you have to do fill out their own application and submit that. Now they have it where it's on the website CASPA, which is kind of the picture I posted over there. And you put all your information there and you can apply to as many schools as you want and send it all at once. Of course, the more schools you apply for, there's a fee for each school that you add on. The really cool thing about, this website, you'll put in things like your transcripts. So it shows all your grades. You'll put any achievements or awards that you received. You need to have evaluations from professors, people in the community. So you have to kind of get that together. And then a big part of it is a personal essay. The essay for the last few years has been, why do you want to become a PA? And they give you a certain amount of limit that you have to write, why do you want to become a PA? And they'll look through that. So that's something that you can start on ahead of time. Although the application opens in April, what's really nice is you can go in before April, upload all this stuff, because a lot of it is stuff that you're supposed to be gathering while in undergrad, even before then. So you can go into the website, put all the information in, and then April 1st, when it opens, you can press in and submit it to the schools. The reason why that's important is because they start filling up seats. So the sooner you can get your information in, the sooner they can look at you, the sooner you can get into an interview. If you, it's not uncommon to not get in the first time for PA school or for any graduate course. So the cool thing about this website is if you don't get in the first time, it saves all the information so that next year when you reapply, you don't have to re-upload everything. You'll just put in the new information of what you've done since last year to help your chances of getting into PA school. After you get selected, so after you submit your application, you start getting interviews. And the way that a lot of the interviews nowadays is they've switched from tell me about yourself and what are your weaknesses and all that stuff to things called MMEs, which are multiple mini interviews. I really like these because it's more interactive. Some of them are games, some of them they give you a paper and they say, please read this and explain it to me. The purpose of these is to assess your personality, to assess your critical thinking skills, and to see how you handle certain situations. Some of them they'll put you with 4 or 5 other people that they're interviewing and they'll have you discuss something, or they'll have you solve a puzzle or anything like that. It's a little nerve-wracking when you go in there because you're like, I don't know what they're looking for. I don't know what I'm doing, but just remember that they're there to see your personality and how you interact. And if you can remember that, you'll do really well.
All right, thank you, NAWAL.
Yeah.
Thank you, NAWAL, for all the information getting into PA school. Now, so once you get into PA school, what to expect? That's what I'm going to talk about here. So usually the programs, they can be a 2-year program or a 3-year program, depending on the state you're attending and the schools you're applying to. So first year usually is the didactic coursework year where you will learn everything about medicine. Usually they break it down into 4 weeks to 6 week sessions. You will learn about human anatomy, physiology. You'll learn in-depth biochemistry, advanced pharmacology, and then all other things like physical diagnosis and physical exam techniques. They also teach you about pathophysiology, microbiology, and clinical lab sciences, laboratory testing. Behavioral sciences is one of the areas they focus on, and also medical ethics is part of usually the didactic year. So once you complete the didactic year, you head into clinical rotations year. For me, I graduated from Baldwin Wallace University in Cleveland, Ohio. It was a 24-year program. Our first year was whole didactic and second year was all clinical rotations. So I ended up, picking 3 elective clinical rotations, and the rest of them were all core rotations, which were family medicine, internal medicine, obstetric gynecology, pediatrics, general surgery, emergency medicine, psychiatry. So all of these rotations, usually you are already scheduled for them during your didactic year, and the school arranges it for you. And once you head into the clinical year, you usually have a white coat ceremony. And then after that, you go on your rotation each month. You spend time with the other physicians under their supervision. You're sometimes allowed actually to see the patients with them, present the patient after seeing them, and also jot down your clinical findings. So this is very good, in terms of practicing medicine the right way, and exposing yourself to the patient population and knowing how to deal with the patients and how to run a differential diagnoses and all that kind of stuff. So for each clinical rotation, after the end of each rotation, you have an end of rotation exam that you have to take. That is just to, gauge how you did, how much understanding you have of the same subject. And then usually consists of 100 questions. And once you pass the end of rotation exam, you start your next rotation, and then so on. End of all those elective years, actually clinical year, you take the PA school graduating exam, which is also very important to prepare for and pass, because that essentially prepares you for PANS, which is a board certification exam you would be taking afterwards. I do want to mention about electives. So picking a school that has options for you to pick clinical rotations and in certain electives is very important, because that could be one of the areas that you want to particularly focus on. So for me, it was more, plastic surgery. I wanted to explore that. I wanted to explore dermatology. I wanted to explore cosmetic dermatology. If you have that option, 2 versus 3 electives in a PA school where they can give you whatever field you want to subspecialize in later on, that would be something that you want to look at. And that kind of sets your board for when you apply after PA school, when you apply for a job. PANS, yes, it is the graduating board certification exam that every PA has to take after graduating from PA school. Usually we prepare for it during the didactic year, during the clinicals year. It is not something that you have to do separately or prepare for it, right at the very end. You should, after your end of rotation exams, after your PA school exam, you should be well prepared to take that board exam. And usually what I have learned from my own experience, I think it's best to take it as soon as possible, because everything is fresh. You know exactly, what you have learned. And, the more time you give in between, you tend to forget things. After board certification, once you receive it, the great day of receiving your board certification and passing the PANS, then you start thinking about, what are the maintenance requirements. So CME, 100 CME hours are usually required for PAs, and it is every 2 years that you have to fulfill that requirement. Now it also includes category 1 and category 2 CME hours that we have to do. CME stands for continuing medical education. There are a lot of seminars, a lot of conferences that go around town, and if you want to learn more about the specialty that you are in already, attending those conferences is going to help you basically. Besides the CME hours, you have to recertify every 10 years. And that recertification exam is something that you prepare for and you take it. We also obtain DA license when we start working. So that is something just similar to NPs that they do, and doctors, everybody has it. And then the state license, yes, every 2 years. So every state is different. So if some states do actually issue a 2-year license, and then you have to renew it if you meet all the requirements. So we have to see it at each state level. Besides that, we also, when we start working as PAs, we have a supervision agreement with the physicians. So we work in very close proximity with them. We always, consult them if there's anything we need to consult about. And, within your scope of practice, you do things that you need to do. So it's a very rewarding experience working alongside the physicians. Okay, so now, this was a lot of information, right? Now the question to ask is whether is it all worth it? all the hard work to become an NP, to become a PA, is it worth it? I would say 100%. Yes, absolutely, it is. For me, you know, being a PA, I got to choose a subspecialty of my choice. I learned a lot. I love the field because I wanted to be in it. You have the opportunity to work as a full-time or part-time PA or even an independent contractor. And salary is pretty good. CME benefits when you start working with a facility. And there are plenty of leadership opportunities that you can take advantage of. So the programs that are available here, local in Texas, we have UT Southwest Dallas, we have UNT Health Sciences Fort Worth, Baylor College of Medicine in Houston, UT San Antonio, Texas Tech Lubbock, and UTMB Galveston. These are the local ones in Texas, but you know, please feel free to apply to branch out, look at other states, look at their PA programs and see which one is well suited for you, because you might have done something which is unique, which they appreciate more than say the ones in Dallas. So say you have more patient care hours, so you'll be well suited for a college which requires more patient care hours. But if you didn't do that, then you would apply to a school which that is not their emphasis. They rather want to see your growth. They want to see how the coursework, they want to see other things. So you need to really, you know, I would suggest just focus on, you know, establishing a resume and then searching the schools that actually fit your qualification and then apply there. So, I also included a link for Texas Tech. So where I think they talk about all the admission requirements and everything. So do all the work, the groundwork beforehand, and then so you're ready when you're applying for the schools and getting into work interviews and stuff.
If I may add one more thing, another difference between the PAs and NPs is for PAs, like you mentioned, we can specialize in different things. The nice thing about PAs, so right now I'm doing family medicine. If next year I change my mind and want to do pediatrics, there's no need to take any exam, any certification. I just get a job in pediatrics. The year after that, if I change my mind, I want to do ER, I just get a job in the ER. There's no need to do any recertifications or anything like that, which is really nice.
Absolutely.
Excuse me, doctor, can I ask? I'm a doctor working abroad. Can I join this PA course in the States? Is there any age problem or anything?
Aisha, you want to take the question?
Sorry, are you currently working abroad right now, or?
Yeah, I'm working in Kingdom of Saudi Arabia as a pediatric registrar
Okay.
in new medications, pediatrics.
Okay.
Now my field is new neurology.
Mhm.
I'm NICO registrar. Actually, my family is living in Texas and I want to join this PA program. Can I join this program? Anything? Is there any age problem? Or I have MBBS. I'm a doctor, physician.
Mhm.
Yeah, so the thing to get in, sorry, I can answer since I'm PA school. I had another physician also had studied, it was working abroad, wanting to come into PA school. The thing you would have to apply to get into PA school, the problem with the issue would be that if you, depending on when you got your undergraduate degree, depending on when you took biology, anatomy, physiology, a lot of PA schools want it to be in the last 10 years. So if it's been longer than 10 years, you might have to redo those classes to be able to meet the prereqs to apply. There are options that you can call up the different schools and say, I've already been a physician, I've been working for 30 years. Of course, I haven't taken classes in the last 10 years. Is there anything you can offer me? And that might be what you would have to do. Otherwise, it would kind of be having to take those classes and apply.
Okay, thank you. And then in which college or school I have to study this physiology, anatomy, or chemistry, this one? You have any other option here? And how much this duration of the course, which I have to finish before to join the PA program?
So,
Okay.
Yeah, go ahead. Proceed.
Dr. Zubair, so thank you for your question. I think where you would want to start is to contact a couple of PA schools and ask them specifically, and let them know about your background and ask them specifically about the prereqs, if they would require you to take all those prereqs in order for you to apply to PA school, first of all. I myself had a physician from India. She was a neurologist working for 15 years and she joined PA school with me. And she contacted the school a year ahead of time before she wanted to get into PA school and asked them all these questions that you have. And what they guided her with was she had to take, because it was more than 10 years, like NAWAL said, she had to take the basic sciences again, unfortunately, for the first year. And then once she met all those prereq requirements, she did apply to the PA school, like as if anybody would be applying, and then she got in. So I know it is going to be a little bit of a lengthy process, but I would suggest contacting at least 3 schools in the 3 states that you would ideally want to come, and then go from there.
Okay, thank you very much.
Yes, you're welcome.
Thank you. All right. And so now, we'll open up for a Q&A session. If someone would like to post it in the chat box, I can take further questions at this time. So,
Is there any difference in this nursing practitioner program plus in the PA, as you discussed with him, plus minus only the difference? Is more, I think PA physician is more suitable for a doctor, not to become a nurse there in States.
yes, because I know with the NP programs, they require to have a prerequisite of a nursing degree as in your bachelor's, and practicing an RN role and having an RN license, like registered nurse license. So it is a start over typically because of the way the Board of Nursing structures the degree. So if someone has already like a medical based background, it doesn't require that specific bachelor's level degree or that requirement in nursing. You can actually apply with the prerequisites and the current degree that you have into the PA program. So it is a little easier when it's changing careers out of different specialties that are there.
Okay, thank you.
So I have one question. The question is, my daughter wants to go for PA program. How many work hours approximately is required before she applies to the program? NAWAL or FASEEHA, you guys can answer for the PA.
So it's difficult to give an exact number because some schools require and some don't. So kind of it would be a matter of looking into different programs that she wants to and see if they have a set number. Like I said, UT Southwestern did not, but I would shoot for about 100 hours if you can, depending on if she's a freshman, they'll be easier to attain. If she's a junior, senior, it might be a bit trickier, but the more the merrier.
And if I remember correctly, if patients or if students are doing pharmacy technician, it does not count for the PA, is that correct? I think there are some questions I've seen in the past with students. Does that count as patient contact hours as a pharmacy tech? Have you guys heard anything with the PA programs rejecting those type of hours?
Actually, my PA school did accept those hours, but yes, you're right. Some of them do not accept it as direct patient contact hours. So that is still a plus to have, but I would definitely suggest working or shadowing in a hospital environment, and especially the specialties that you like and you think that you're going to work in the future. So that I think would be a good idea. So direct patient hours, usually at least 50, I would recommend. And then in total, if you have close to 100, that would really stand your application out. And exactly what they want to do is they want to see whether you're committed to this field, whether you're willing to spend time, you're comfortable seeing the patients, and so all those things.
And kind of going off to that question, scribe is another one that some schools accept and some others don't. That's a lot of my class did do scribe, so at UT Southwestern we accept it, but that would be something that's important to look into. So I saw a question, scribe or MA. I think MA is great because you get a lot of hands-on patient interaction, which is what they're looking for. You get comfortable giving injections and drawing blood and all that. So, but the downside to becoming an MA is it's going to be a few months to finish their degree. So you have to kind of look at what programs will accept it and how much time you have.
Right. And then I saw a question regarding starting salaries for NPs and PAs. So for NP, for our specialties, the range is anywhere from 100,000 starting. Some places might be up to 115,000 starting. And then it increases as you're in practice longer. So many places that you work, they're going to base it on years of experience and also what specialties you're applying to. Primary care and internal medicine might have a little bit lower ranges. And then specialty like GI cardiology, they're going to have a little higher range. It goes up as the years of experience go up. So once you hit like 5 years, you might go into 140,000 up to 160,000 is what kind of I've seen. If you're in a very nice specialty like surgery or those things, it could go even higher, like 150 plus. So it just depends on the area of work and as well as years of experience. But so first starting out average is about 100,000 minimum. And then the highest maybe 115 up to maybe 120,000 I've seen some places. So for PAs, I'm not sure, it might be very similar there.
Yes, absolutely. It is similar. Same numbers, starting probably might be 103 up to 110, 115 at the most. And then as you gain experience during your working and, it goes up significantly. So I would say, again, it's based on your expertise, the area and the subspecialty you're working in. It can go up as high as 160 or more.
They make a pretty decent salary. So yeah, I mean, we're good.
And I have one question. I have an RN that's recently accepted to an NP program this fall and is looking for preceptors in the DFW area. So we will be doing a mentorship program with Allied Health to further expand these services where you can actually join in the AMWPA program and then have a mentorship that's linked to you. For me personally, as a GI, it's a specialty, so many programs might not apply that. They only have a certain limited hours that they apply for specialty. And in my urgent care practice, it requires a formal application through CVS actually for application. So there's not a freelance that we can do for preceptorship hours. But I do encourage to go to amwpa.org and there's a mentorship link that you can email to see if we have any preceptors available. And then, okay.
Go ahead.
Okay, I was just going to the next question. If anyone, did I want to add to that?
Well, okay, I'm just gonna add on. I mean, I am taking any student. In fact, right now I have one with me. So, I mean, yes, if you need hours like in a geriatric area or cardiologist, I may become your preceptor. Just kind of let me know. But yeah, I've been doing preceptor like I don't know for how long now. So just for you to know.
Okay.
And congratulations on getting accepted.
Yeah, congratulations.
Yeah, congratulations.
All right. So next
Excuse me,
question.
madam.
Oh, yes.
Can I ask one question?
Yeah.
If you can please put it in the chat box, please, because we have a few questions coming in so we can keep the order. Thank you.
Okay, I'm just gonna move next one, but yeah, please do put it on the chat box and I'll get the question there. So next one I have is we mentioned talking about joining leadership for getting into these programs. What type of leadership do these programs look for? Like, such as if someone's working as a manager in a restaurant, would it count? So I think for PA that's more applicable if FASEEHA or NAWAL want to take that question.
Yes, so medical missions would be something that I would highly encourage any undergrad student getting involved in. So there are plenty of opportunities in the colleges that you're undergraduating from. Also, you know, free volunteer in free clinics, you know, around the area is also something that I would like you to be part of. In terms of leadership, of course, you know, being in the as a secretary or a club, you know, vice president, president, this all shows, you know, your commitment along with education that you want to be in a leadership role and also managing all those aspects of life together. But definitely, if you can lead one of the medical missions, be a part of their administrative team, that is going to really help you in the future. I have seen many people, you know, benefit a lot from that. And Noel,
Yes.
what?
Yeah, I second what FASEEHA said. Medical groups are great. It's a good, at least from, you want to join multiple organizations, even if you're not the president and secretary of every single one. The more you can put in, the better. But definitely have at least one or two that's medical related. A lot of schools will have pre-PA organizations that you can join. Those are really nice because they'll get you volunteer opportunities. They'll have guest speakers come and talk to you. They'll prepare you for when the CASPA opens and all that kind of stuff. So I would look into pre-PA organization at whatever school you're in. And then kind of what FASEEHA said, the reason why they want you to be involved is because they want to see PA school is, they literally say it's like drinking water from a fire hydrant. It is so much information at you at once. So they want to see that you're able to, in undergrad, do really good during school while being involved, while doing this, while doing that and all that, and seeing that you can balance everything, because I'll make them feel better about choosing you into their program because they'll know that you're able to carry out huge workload. So that's kind of why they like to see you being involved. And student government is another great way to get involved.
Thank you. All right, and one question was whether AMWP offers any student loans without interest at this time. We do not offer anything like that nature at this time. However, we do have scholarship opportunities for applying for students in the healthcare field every year. So I do encourage going to amwpa.org and you can look for these scholarship opportunities to apply for. And then I had one question regarding dental school admission, if there's a Zoom lecture that's on that. If I remember correctly, I believe we do have one for dental school. If there is a YouTube link for AMWPA programs that have been previously offered. So I do encourage you to go to AMWPA YouTube channel where these lectures will be posted. And there should be one, if I remember correctly, for dental school admission that's already been offered previously there. And then the next question was, is there online PA programs for students, and is there an age requirement for PA? So FASEEHA or NAWAL, if you guys want to answer that one.
So there is no age requirement, in my opinion. I think I have people attending PA school from ages 21, 22 to 60. And you just have to meet all the requirements. Online virtual programs, I don't know, during COVID times, maybe there were some didactic year was online, but mainly clinical rotations are not. So that is something that you would have to check with the schools themselves. As far as I know, I don't think there is a virtual program. Nawal, please correct me if I'm wrong.
Yeah, so with COVID, they kind of are figuring out ways to go do things more online. There's not a lot of online PA programs, but I do see that there are a few accredited PA programs. That's another thing. Whenever you're applying, make sure they're accredited, or else you go through that program and then you won't be able to take the PANCC because the school you went to wasn't accredited. But when I'm looking online, there seems to be a one in Massachusetts, one in Nebraska, there's one in Texas, the Rio Grande Valley. So there's about 7 or 8 that are fully online. So that might be an option for you.
Thank you.
And Aisha, I wanted to add, just take a moment and add anybody listening to our talk today. We are always here to help. You can reach out to me if you have any questions about PA school further. I can be reached at FASEEHA@mydermpa.com, or you can definitely contact our host, Aisha, about that information, contact AMWPA. I'm looking forward to contributing to this field of medicine, and I'm so excited that there are more and more individuals are getting interested in both NP and PA programs. So I'm always here to help. So feel free to reach out back to us. Thank you.
And yeah, also like amwpa.sec@gmail.com. It's our secretary for this nonprofit organization. We'll also be if you guys have any questions or need a direct contact to us, she can also connect you with us if there's any questions. All right, and let's see, I don't see any more questions. Does anyone else have any questions for our Q&A session here?
Ma'am, your address, please.
Oh, the address. So the address for the AMWPA secretary, the email address, it's amwpa.sec@gmail.com. And they can connect you to one of us if you have any questions.
Okay, thank you.
Thank you. Anyone else with any questions before we end our session today? All right, well, thank you so much, everyone, for attending our session. I really want to thank all our panelists for taking their time today and answering these questions and providing a very informative session for our group today. It was a pleasure having everyone here with us. Thank you for your time.
Thank you, Aisha. Thank you.
Thank you, Aisha. Thank you, everyone.
Thank you, madam. Thank you. Assalamu alaikum.
Nice.
Thank you, Sam.
Go ahead and
See you again.